Hello everybody. Today I'm going to be explaining to my aunt, her name is Jeanette, how to do a self-oral exam on herself and make sure there's no lesions or any abnormal things in her mouth. Okay. Start off by kind of explaining a few things. So what we'll need for this procedure is, in a second we'll grab it, but we need a flashlight, a mirror, so that you can check yourself. We'll also need washcloth or some gauze or something to where you can hold your tongue and check those areas as well. We got all of our stuff, and so first I'm going to explain to you some of the things that you could see that are not good for your mouth, and I have some pictures that I'll show you in explanation as to the bad lesions that we can find in our mouth whenever we're doing oral examinations. Look for is like discolored areas that are discolored, or lesions in the side of your mouth, so like bigger kind of bumpier areas, so bumps, lumps, or even cold sores on the side of your mouth can not be a good thing to see, or even like a texture change. So like if you have bumps in the side of your mouth and you can feel it, it has a texture, or anything like that is good to look for whenever you're looking into the mouth. So one thing that you will need to do is you need to do a self-oral examination once every month, to make sure that you don't have anything pop up, because things can pop up overnight that could be cancerous, or that can be a not good lesion, and so we want to make sure that that's not in there. Okay, so I'm going to show you some pictures of the not so good lesions. So these pictures right here are okay lesions. So this is called a fissured tongue, this is called a black hairy tongue, this is called tori, which is extra bone in the mouth, and then this is called a geographic tongue. And
that's not good, right?
Those are the okay ones.
They're okay?
Those are normal. Yeah,
oh,
there's
okay.
some people that actually have those things wrong with their mouth. And so these right here are the pictures of the bad lesions that may need to be looked at by a doctor if you find them pop up. So you see here how there's a lesion right there, which could have been from just biting your lip, but that also can...
I did that a lot.
Yeah, it also could turn into cancer or anything like that, so you just want to make sure to try not to do that. And then this bump right here looks to be like it could be cancerous, and what you do is you go to the dentist and you get a biopsy taken of it, and they'll see if it's cancerous or not. That right there is a discoloration of the tongue. Could be a few different things, could be thrush, could be different things wrong with it, but it's good to get that checked out as well. This right here, you know, could be cancerous. On the side of the tongue, you want to make sure you're checking both sides of the tongue. Out here on the lip, you see how that is there. On the side of the mouth, so just going in and seeing anything, if there's anything in the back or the roof of the mouth, or on the outside of the lips.
This is the back of your throat, isn't it? Or is it?
You can have them on the back of your throat. So what I'm doing is I'm just showing her some different pictures. I'm going to explain to you how to check these areas. So if you have a mirror, so we have our mirror. So I'm going to get you to hold your mirror and your flashlight. And I'm actually going to show you a video of me doing the oral examination on myself. So here it is. And so you see how I'm checking all different sides. I have a piece of gauze and I'm pulling my tongue from side to side and up and down, and making sure that there's no lesions on the top and on the roof of the mouth, and on the sides of the mouth. Okay, so just like that, I want you to do your oral examination. So you're going to start by using the flashlight to look in the back of your mouth, make sure there's nothing in the back of your throat, and see if there's any lesions like the ones that I showed you. Doesn't look like anything. And so then I want you to check your cheeks, the inside of your cheeks, so on this side. So just check the inside of your cheeks. Yep. Yep, and then your gums.
They're terrible.
Okay, and then now I want you to take this piece of gauze, and I want you to pull your tongue out with the gauze, and I want you to move it. Yeah, check the top of it, make sure it looks okay. And then I want you to pull it out, pull out your tongue with the gauze. Yep, grab it with the gauze, and then move it to that side, to the left, your tongue, and move it to, yep, and look in the bottom, and then pick up your tongue and move it that way. Like, put the gauze around, yeah, there you go. Make sure there's no lesions on that side, and then move it to the other side. Make sure there's no lesions on that side. Okay. Tongue to the roof of your mouth, and look on the floor of your mouth. Okay, and then, you know, if you see these lesions in your mouth, you need to immediately call the dentist and make an appointment and go to that appointment, because it could be cancerous and it could be more life-threatening than you really think that it really will be. If you see anything that may be bad, they'll just take a biopsy of it and make sure to get you all situated. And then in this little slideshow, I'll send it to you. I have some helpful websites and videos and stuff that you can watch to make sure that you're doing it correctly and using these techniques at least once a month to make sure that everything is okay with your mouth. And yeah.
Thank you.